I am from here, born and raised from San Diego County. I was born with hypertrophic cardiomyopathy.
Brandon has been my patient since June 2012. We knew he had a history of hypertrophic cardiomyopathy, which is a condition that can lead to sudden death. We knew that he had that diagnosis at the age of 8.
I didn't quite have any problems with it until maybe like 20. That's when we decided to put a pacemaker in.
Fortunately, we did that because later, a few weeks later, he came in with a very serious rhythm that could have been life-threatening. But because he had the device was able to rescue him from a very serious problem.
I met Brandon probably about a year after his defibrillator was placed, when he presented with atrial fibrillation, which is a rapid irregular rhythm from the top part of his heart. Brandon has done remarkably well for the past 10 years or more. In a lot of ways, he's not been limiting by his underlying diagnosis or his condition.
Here's a young man who has a condition that many people would call into a corner, where once a diagnosis is made, the fear that kicks in, the sense of vulnerability and inability to get beyond it, does not allow the person to grow. He took the exact opposite approach. Within 3 months of that event, he said, I'm going to go to medical school. Now, this is back in 2012. This is a young man who's made the decision, I'm not giving up.
I am in my 4th year of medical school now. It truly was my first visit with Dr. G that had me sold. You know, I was like, I want to do that. It helps to have something grounding you, and during the hard times, I look down at my pacemaker and I keep going. When I started med school, my biggest reason was I want to make someone feel like Dr. G made me feel. I knew Dr. G was looking out for me.
His history of learning medicine over the years now allows me to go through things that really he can understand much better, that he did not necessarily understand when he was 20 years of age. So for us to be able to sit there and go over all the details of his history was great. It was great in the sense that it gives him a sense of empowerment, but also it shows me how far he's come, and I'm sure he's going to continue to build on that knowledge as he goes forward.
I always compare myself, how far am I to knowing as much as Dr. G? And the thing is that I'm realizing now, every time I see him, he knows more, you know? So I don't, I don't think there'll ever be that time where I'll catch up, but to learn from someone like that it'd be priceless.
I'm exceptionally proud of him. He's such a warm person, and everyone here knows that. He's so giving. He volunteered at the hospital for Sharp. He's always wanting to go out and talk with people who have his condition. So many people, when they have a medical problem, they don't want anyone to know about it. It's embarrassing to them. He took the opposite approach. Look, this is what I've experienced, and this is what I'm doing to get beyond it. He's the best role model that I can think of. I can't think of anyone on his level that took an illness and turned it into a motivator, and that's what he's done.
Dr. G would be the exact physician on how I would want to move. The amount of knowledge he has, the way all of his patients feel warm and trusting towards him as soon as you meet him, and you see why right away, you know. It's funny that every time I come back from medical school to get a checkup, I feel like I'm a little bit closer to the dream of working at a place like Sharp. In Memorial, you see the big windows, big building, and you would think, what would it feel like to walk around as a physician on these floors? And honestly, it gives me like little chills thinking about it. It's all of our med school dreams, and especially mine, to make it come full circle.